We have a graphic here showing some of the most common conditions. And Dr. Arenas, will you walk us through these, some of these post-stroke conditions?
Yes, so we have dysphagia. Dysphagia is swallowing difficulty that patients can present. So depending where the stroke happens, usually in the most inner and lower parts of the brain, very close to the spinal cord, there's a center for swallowing. When the stroke goes to that part, patients can present swallowing problems that we need to treat because it can put patients on risk for aspiration, which is when the food goes to the wrong way and it hits the lungs, and eventually they can develop pneumonia. Patients in the hospital, and it's another complication.
Right.
Fatigue is very frequent for these patients, and it goes usually with sleep problems as well. Sometimes we need to give medications to patients so they can sleep through the night and be able to be totally awake during the day.
What causes the sleep issues with a stroke patient?
The sleep issues is, again, because the sleep centers are usually linked to this. Sometimes if they have pain, they cannot sleep well. So there's other factors linked to the presence of the sleep abnormalities. And that's when we need to probably give some medication to try to compensate this.
And then we have hemiparesis.
We have the hemiparesis, foot drop, that is very common. It's one side of the body, the arm and the leg they get very weak with foot drop. Incontinence as well, is the lack of voluntary control over defecation and urination. And it's very common to see this in patients. They need to be put on a bowel and bladder program. We need to involve the nursing staff for this and train the patient and the family members in order to be able to work with incontinence. Pain that we spoke about, paralysis, is very similar to hemiparesis. It's weakness as well in the arm or the leg. And seizures and epilepsy, it depends again on the areas of the brain that were affected. Some patients can present as well with post-stroke seizures.